Don't want to go overboard on lip enhancement. Want to keep a natural look with bigger upper lip, more definition for pigment. I have attached a photo combined with my current lips on the top image and desired look at the bottom. What's the best solution to achieve this look? Please help. Many thanks.
Thank you for your question. You submitted a photo of your lips, and you submitted a photo of what an ideal appearance that you'd like to achieve. And in your question, you're basically concerned about the proportion of the upper lip, and you don't want to, quote, go overboard with the correction. So you're looking for some guidance on how to achieve this. Well, I can certainly share with you my approach doing this type of procedure, which we do with fillers every day in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and enhancing lips is a very significant part of our day-to-day practice because this is an area that's very popular, very sought after. And I can certainly share with you a little bit about what the typical conversation is with someone who either comes in interested in improving their lips, or someone who, as I'm doing their evaluation, I would discuss with them about the benefits of enhancing their lips. And the first concern is always not to look overdone, not to have duck lips, not to look like XYZ celebrity, not to look like many people who have not helped the cause of improvement on lips without looking like you've gone overboard. So I'll share with you a little bit of the principles that guide me as to how I approach my patients and how I guide them and do the procedure in a way that has been consistently successful. So to begin with, the photo, the idealized photo that you submitted, has essentially shows what is the ideal, to a degree, of a youthful, balanced lips. And it basically comes back to a universal proportion in nature called the golden ratio. And the golden ratio is essentially a proportionality of the upper lip to the lower lip. Throughout the appearance of an aesthetic face, when it comes to different lines and balance between different areas of the face, but basically the numbers are 1 to 1.6, where the upper lip represents 1 and the lower lip represents 1.6. A rough estimation can also be 1/3 to 2/3. Now that has to do with the volume of the lips. Then in addition, we look at the vermilion border, or the border of the lip where the lip liner would be placed, the philtrum, the pillars, the philtral pillars. I mean, there's a lot of little areas. There are other areas called G-points on the lip. So there's a lot of artistry and understanding of what looks natural, and then where you draw the line as to balance. One of the things that I think a lot of people are challenged by is the challenge of a degree of swelling after having lip injections done. And I share with my patients that one of the ways that I've essentially evolved in approaching that issue is through the use of certain instruments in a way that delivers the material into the body of the lip without needing multiple pokes. And although certainly there are many doctors who believe in placing the injections directly through the front of the lip or into the pink part of the lip directly, I do it a little bit differently, and I've found it to be very, very predictable and very balanced and very nice. Now, there are a lot of ways to do this, so technique is important. But in addition, it's also about the aesthetic vision of the doctor and the patient. So, generally speaking, I would actually I would do something like put your pictures up on the screen, and I would show you the areas that I would want to add some volume. And then essentially my general approach with this area is to be conservative and explain to my patients that when we see you in follow-up, like in 2 weeks after the treatment, then we can always add if we want to. It's a very delicate area that can swell, and it can actually affect the final or the perception of what things will look like once swelling goes down. And at the same time, people don't have a lot of downtime, and they want to be able to, for example, have the procedure done today and then be presentable for tomorrow, or even later on the same day. So I think it's very, very important. Technique does matter, but more important is first the vision of what the outcome will be. So I think that you're on the right track. I would suggest to you and I would agree with you that the upper lip is disproportionate to the lower lip. So enhancement with that area, with what I recommend usually is a hyaluronic acid filler, something that's on the softer side, something like Restylane or Juvederm Ultra, are going to be really good options when it comes to enhancement of the lip area. And I think that discussing with your prospective doctor the techniques and what method will most likely result in what they feel is going to be predictable, but more importantly, minimize the amount of swelling that occurs after the procedure. Sometimes a little swelling is just part of the reality because of the different areas that need to be treated. For example, if we treat the vertical lines of the lips, if we treat the border of the lips as well as the pink part of the lips, well, then there's a little bit more manipulation that's done in that situation, which means proportionally there's likely to be a little bit more swelling. But again, like I said, when I do this, I try to, especially for the pink part of the lips, I actually approach it with special instrumentation, so I only make one entry point, and I'm able to add the volume with minimal trauma as possible, and it's worked out well for our patients. So learn more about these options. I think you're on the right track, and just find the doctor that best suits your personal style and vision. So I hope that was helpful. I wish you the best of luck, and thank you for your question.